What I'm about to share could save your life, or the life of someone you love, so I need your full attention for the next few minutes. There is a virus circulating right now, across the United States and in parts of the world, that most people have never heard of, that most doctors don't bring up, and that is quietly sending adults, particularly those over 60, into intensive care units with almost no warning. It's called hantavirus. I'm going to tell you exactly what it is, how it enters your body, what it does once it's there, and, most critically, the 5 things every adult over 60 should do this week to protect themselves. The numbers you need to understand. The most severe form of this disease, Hantavirus Pulmonary Syndrome, carries a case fatality rate of 38 to 50%. That means nearly 1 in 2 people who develop the serious lung form of this illness do not survive it. And here is what isn't being said loudly enough. Adults over 60, whose immune systems have naturally declined compared to a younger person's, are among the most vulnerable people on Earth to this virus. That vulnerability is not a minor footnote. It is the central fact that makes this conversation so urgent. What hantavirus actually is. Think of your body as a city. Your immune system is the police force patrolling every street. Now imagine a threat so small and so efficient that it slips through a ventilation shaft, bypasses every checkpoint, and goes straight for the power station, your heart and lungs. That is hantavirus. It is a single-stranded RNA virus belonging to the Bunyaviridae family. It has existed for thousands of years, living quietly inside rodent populations. The deer mouse is the primary carrier in North America. The animal itself rarely gets sick. It simply carries the virus in its saliva, urine, and droppings, shedding it constantly, silently, with no visible warning at all. In North America, the primary strain responsible for severe illness is called sin nombre virus, which translates from Spanish as the virus with no name. It was first identified in 1993 during an outbreak in the Four Corners region of the American Southwest, where a cluster of previously healthy young Navajo individuals died of a mysterious respiratory illness that baffled physicians. In South America, a strain called Andes virus carries the additional and terrifying distinction of being the only known hantavirus capable of spreading from person to person. In Asia and Europe, different strains cause hemorrhagic fever with renal syndrome, attacking the kidneys rather than the lungs. All strains share one thing in common. They exploit exactly the kind of immune vulnerabilities that naturally accumulate in an aging body. How the virus spreads. The primary route of infection is inhalation. You breathe it in. When infected rodents urinate, defecate, or shed saliva in an enclosed space, a garage, an attic, a basement, a cabin that's been closed for the winter, a garden shed, even an old car left sitting unused, the virus attaches to tiny dust particles and becomes aerosolized. When you walk into that space, when you sweep up droppings without protection, when you move boxes that have sat undisturbed for months, you inhale those invisible particles. They travel down your airway and reach your lungs. Research published in Emerging Infectious Diseases has found that the virus can remain viable in the environment for several days, and in cool, dry, sheltered conditions, potentially longer. Secondary routes of infection include touching rodent droppings and then touching your face, eyes, or mouth, and, far less commonly, rodent bites. Why age changes everything. After age 65, the mucociliary clearance system, the tiny hair-like structures lining your airways that trap and sweep out foreign particles before they reach your lungs, declines in efficiency by approximately 30 to 40%, according to research from Johns Hopkins University School of Medicine. What a 35-year-old might partially clear before a pathogen reaches deep lung tissue, a 68-year-old is far more likely to have reached the alveoli, the tiny air sacs deep in the lungs where hantavirus does its most devastating damage. Your innate immune response, the rapid-fire first responder system that attacks pathogens before your adaptive immune system even mobilizes, also fires at a fraction of the efficiency it had when you were younger. You simply do not have the same biological margin for error. That is not a reason for fear. It is a reason for knowledge and preparation. The progression of illness. The incubation period ranges from 1 to 8 weeks, with most people developing symptoms between 2 and 4 weeks after exposure. That long, silent window is one of the most dangerous features of this disease. You can feel completely fine while a storm is building inside you. The illness begins in what physicians call the prodromal phase. Think of it as the sky darkening before a hurricane. For the first 3 to 5 days, the infected person experiences what feels almost exactly like the flu: fever, fatigue, muscle aches, particularly in the large muscles of the thighs, hips, and back, headache, dizziness, and sometimes nausea or vomiting. At this stage, Even physicians not specifically looking for it would likely assume influenza or a common viral illness. Meanwhile, the virus is quietly replicating inside the cells lining your blood vessels, endothelial cells, causing them to begin leaking. Then comes the cardiopulmonary phase, the phase that sends people to the emergency room. As blood vessels in the lungs become increasingly leaky, fluid floods the air sacs. The lungs, which should be light and open like a dry sponge, begin filling with fluid. Shortness of breath develops, not mild breathlessness, but a terrifying gasping inability to get air. Oxygen levels plummet, blood pressure drops. The heart, struggling without adequate oxygen, begins to fail. Hantavirus Pulmonary Syndrome can progress from the first sign of respiratory distress to complete respiratory failure in as little as 24 to 48 hours. Many patients require mechanical ventilation and ICU admission within a single day of their breathing becoming compromised. There is currently no specific antiviral drug approved to treat hantavirus. Treatment is entirely supportive: oxygen, mechanical ventilation, fluid management, and time. This is not a disease where a prescription sends you home. Prevention is everything. Real cases, real consequences. In 2012, 10 people contracted hantavirus linked to tent cabins at Yosemite National Park in California. 3 of them died. The CDC investigation found evidence of rodent infestation in the insulation of the cabin walls. Thousands of past visitors had to be notified and monitored. In 2020, a man in his early 60s in Washington state spent a weekend cleaning out a long unused storage barn on his rural property, with no respiratory protection because he'd done similar work dozens of times before without incident. Within 2 weeks, he had developed what he believed was a severe cold. Within 48 hours of hospital admission, he was on a ventilator. He survived after 18 days in the ICU. His breathing capacity never fully returned. In Argentina's Chubut province in 2019, an outbreak of the Andes virus strain resulted in 29 confirmed cases and 11 deaths, with documented chains of person-to-person transmission, including one healthcare worker who contracted the disease from an infected patient. In Colorado, Utah, and New Mexico, historically endemic zones, public health departments regularly report cases, particularly in spring and summer. In 2023, Colorado confirmed 3 cases of Hantavirus Pulmonary Syndrome. 2 involved adults over 65. One of those individuals did not survive. The 5 things to do this week: 5. Conduct a thorough rodent audit of every enclosed space on your property: garage, basement, attic, garden shed, any outbuildings, your crawl space, stored vehicles that sit unused for extended periods. You're looking for droppings, small dark grains resembling rice, gnaw marks on wood or packaging, nesting materials made from shredded paper or insulation, grease marks along walls, and a distinctive musty odor. Do not bend down and sniff in enclosed spaces without protection. Open doors and windows and allow at least 30 minutes of ventilation before entering. Research from the University of New Mexico found that nearly 12% of deer mice trapped in rural areas of the American Southwest carry sin nombre virus. 1 in 8. That is not a remote risk. 4. Use the correct personal protective equipment and understand why it matters. When entering any space with evidence of rodent activity, you need an N95 respirator, not a surgical mask, not a cloth mask. An N95 creates a tight seal and filters at least 95% of airborne particles. A surgical mask allows air to flow around the edges and provides essentially no protection against aerosolized hantavirus particles. You also need disposable nitrile gloves. For significant infestations, a disposable Tyvek suit or old clothing you can immediately bag and wash in hot water is advisable. The protective equipment costs approximately $15 to $20 at any hardware store. The average ICU stay costs $3,000 to $10,000 per day. After the age of 75, your body has approximately 35% less pulmonary reserve, the extra breathing capacity that kicks in when your lungs are under stress. You have less margin than you think. Ventilate before entering. Open all windows and doors and allow 30 minutes of fresh air circulation before going in. 3. Use the correct cleaning method, because the wrong one can be fatal. If you found rodent droppings, never dry sweep, never dry vacuum, and never use a leaf blower. These actions aerosolize virus particles and create a cloud of infectious material you then inhale directly. The CDC protocol. Wet the area thoroughly with a disinfectant solution, a commercial disinfectant or 1.5 cups of household bleach per gallon of water, and let it soak for at least 5 minutes. Then, wearing your N95 and gloves, Use paper towels or disposable cloths to pick up the dampened material and place it immediately into a sealed plastic bag. Double bag it. Dispose of it in a covered trash container. Wipe down all surfaces rodents may have traveled across with the same bleach solution. Mop hard floors. Steam clean carpets where possible. This wet cleaning method reduces exposure risk by an estimated 90% compared to dry sweeping, according to guidelines from the New Mexico Department of Health. For an aging immune system, this is not optional technique. It is the difference between manageable risk and potentially fatal exposure. 2. Know the specific symptoms that require emergency action and act on them immediately. The window between the beginning of symptoms and the point of no return in a hantavirus infection is measured not in days, but in hours. If you experience the combination of fever above 101 degrees Fahrenheit, significant muscle aches, particularly in the thighs and back, and progressive shortness of breath that worsens over hours, and if you have had any potential rodent exposure in the past 1 to 8 weeks, go to an emergency room. Not urgent care. Not your doctor's office in 2 days. An emergency room, today. And when you get there, say this clearly. I may have been exposed to hantavirus. I was near rodents. Please test me for this. Do not assume the physician will make the connection in a busy emergency room. You are your most important advocate in that moment. After 65, a phenomenon researchers have called inflammaging means your body may not signal illness as clearly as a younger person's would. You may feel less sick than you actually are. Take symptoms seriously. Act fast. 1. Have a direct conversation with your doctor before you need it. This is the step almost no one takes, and it is the most important one. A 2022 survey by the American Geriatric Society found that fewer than 8% of adults over 65 had ever discussed zoonotic disease risk with their primary care provider. Your physician can do something no 995 mask or bleach solution can. They can assess your individual immune status. They can review whether your current medications, antihistamines, corticosteroids, certain blood pressure drugs, may be suppressing your immune response in ways that increase your vulnerability. They can note your risk profile on your chart so that if you arrive in the ER with respiratory symptoms, the connection is made immediately. They can flag you for priority testing and transfer to a facility with the specialized intensive care that gives survivors their best chance. There is no vaccine for hantavirus. There is no antiviral medication you can take prophylactically, but an informed physician who knows your risk profile is your earliest and most powerful line of defense. Before your next appointment, do the rodent audit. Then walk in and say, I want to talk about hantavirus risk. I live near or visit areas where rodent exposure is possible. What do you need to know about me? And what do I need to know in case I get sick? That conversation could be the one that saves your life. What to carry forward? You are not helpless in the face of this virus. You now have specific, actionable knowledge that most people, including many of your peers, do not have. You know what hantavirus is and where it lives. You know how it enters the body and how silently it can progress. You know what real cases have looked like and how quickly they can escalate, and you know exactly what to do. Do the audit. Get the N95 and the gloves. Learn the wet cleaning protocol. Know the symptoms that demand emergency action, and have that conversation with your doctor. None of these steps are complicated. None of them are expensive, but collectively, they are the difference between being protected and being exposed. The ability to open your own cabin in spring, to clean your own garage, to spend a Saturday afternoon in your garden shed, these things matter. They are not trivial. They are the texture of a full and independent life, and it is absolutely not too late to protect that life. Starting today, hantavirus moves from something you didn't know about to something you know and can act on.